My name is Nestrouy Misomali from Malawi, which is a country far in the southern part of Africa. Currently working as a senior laboratory technologist in the National Genomics and Sequencing Reference Lab in the Public Health Institute of Malawi, which is a directorate in the Ministry of Health. Basically, our mandate is to take lead in disease surveillance, prevention, as well as outbreak response, and take lead in research so that we can inform practice and risk policy. Hospitals send clinical samples so that we can predict bacterial resistance, so that we can inform the choice of antibiotics so that patient can be given the right cure. My research interests is more oriented toward clinical pathogen metagenomics based on high-throughput sequencing. I'm kind of much interested in expanding my knowledge in understanding the pathogen identification as well as antimicrobial resistance prediction, particularly in understanding the methodologies and the practice that we can employ and make sure that we are able to confirm these outbreaks as quickly as possible. So I feel like coming to BGI is a privilege to me because what we are learning is definitely what our country needs, because using the conventional methods that we have there, that has proven to be a little bit lagging in terms of the time it takes in order to confirm such outbreaks. But now coming here at BGI, we are learning that the metagenomics using high-throughput sequencing is the way to go now because it's fast, it's accurate and efficient. Meaning to say, if we employ what we've been learning here, definitely my country will benefit a lot because we will reduce the delay that is there to inform the response of outbreak management. In our end, we are currently struggling much with outbreaks such as cholera. We're also experiencing a lot of HIV issues. Recently, we've been talking about Mpox. It's quite very difficult in our setting where the clinicians are struggling to which antibiotics they can use to treat a patient without having a resistant profile. I was also very much interested in understanding on how we can use the genomics and sequencing to predict the resistant and maybe create a resistant profile. The knowledge and information we are learning about metagenomics on how we can quickly identify pathogens, how we can predict the antimicrobial resistance. These are critical issues that needed in either public health or as well as in the clinical setting. We had a chance to go to Beijing, which is the capital city. There we managed to visit the China CDC. It was quite interesting learning from the experts. They have integrated all the institutes at one point. We were able to visit the Changsha CDC, and it was quite very interesting to learn that Changsha was leading in eradicating malaria infections. And they were able to declare that Changsha and China is malaria-free, which was very interesting because these are the diseases that we are continuously struggling in our country and Africa in general. I've learned that as Africa in general, we are experiencing more of similar issues pertaining to outbreaks. I feel like genomics and sequencing is the way to go, not only here in China, but even in Africa, and particularly in our country, Malawi. If we could employ the innovations and the solutions that BGI is offering, I think can strengthen our response mechanism, we can strengthen our surveillance system, as well as an overall response to whatever problems we are having, because the solutions have proven to be fast. We should be able to detect outbreak as quickly as possible. We can equally deploy that mechanism to predict the resistance pattern. I feel like much of the African public health systems, including ours in Malawi, will be very much influenced with some of the technologies that we've learned here. I really feel this is the center of innovation, and it's quite amazing to continuously hearing from such people who have accomplished almost everything in life. It's a privilege because not only I'm learning from the BGI technology, but also equally my friends that we've come together as participants. As a step going forward is I would want to work on a research that will focus on sequencing AMR data so that we can solve some of the problems that we are struggling with. I would want to create a base of interaction and possibly continuous collaboration with my fellow participants from Africa as well as BGI so that we continuously exchange the knowledge that we've had and acquired here, so that we don't lose this knowledge, but we continuously remind each other and continue using it in our everyday routine work.